As we went through the fundraising effort, had a professional fundraiser here to help. The suggestion was, as the campaign was winding down, we'd met the goal, was you shouldn't stop this. The opportunity is there. You've already got the community thinking about, and the community wants to support their hospital. So now's the time. Take a foundation. You've got a core group already together. Form a foundation and start from scratch.
The foundation of CVPH Medical Center has been improving the health of the North Country for 25 years as the philanthropic arm of the hospital. It was officially incorporated in December of 1989.
Rod and I and Bill Morgan and Ralph Boyer and Nina Coolidge, and it was a bunch of good people, and it was a tough beginning.
Early programs like Heart Smart for Kids, smoking cessation classes, and regular community health screenings were giving people information and tools they needed to live healthier. In 1990, the Roger Senecal Fund, our first travel fund, was established to assist families with the financial burden of travel expenses when their child needed to travel out of the area for specialized health care.
The Roger Senecal Fund, that's where it all kind of started from. And we had a personal acquaintance with Roger's dad through business. And I remember how devastating it was to the family. And it was wonderful that the community came together and then something good came out of that.
Over the years, other funds have been established to help any qualified individuals who need to travel for health care. These funds are a lasting tribute to those who established them, and they have touched the lives of 750 families in our community.
By the time the ambulance got to our house, he was blue. They flew him from CVPH to Albany Med, where we were in the PICU for a week. We didn't know what was going to happen. In Albany, my mom and fiance were able to stay right at the hotel. I, of course, never left him, but I knew they were there if we needed them.
Community health lectures empower North Country residents to take charge of their health and offer access to highly experienced physicians and clinicians. Over the years, there have been nearly 250 various lectures presented, and approximately 10,000 people who have learned about heart disease, diabetes, raising healthy children, and so much more. In addition, thousands of women have turned out for the popular Girls' Night Out, which reminds them that taking care of you never goes out of style. Diabetes is an epidemic across the country, and our region is no different. Your support has helped hundreds of diabetics learn how to live with and manage their disease and live well despite it.
By going to the class, it helps the patient realize that it's not like this terrible sentence that, oh, you have type 2 diabetes. You can manage it. We both have dropped a significant amount of weight on the diabetic diet.
I was very pleased with the doctor the last time when he told me he didn't have to see me for a while. So
it's a blessing that our community has folks like Ann and her staff, because I think it's been a life-changing thing for Dick and I. It really has.
Even high school students have been helped by the foundation and auxiliary through scholarships. These scholarships are given to graduating seniors pursuing a career in healthcare. We're investing in the future with the hope that these scholars will return to the North Country. In 2000, the Safe Kids Adirondack Coalition was formed to help prevent unintentional childhood injuries, part of a national Safe Kids organization. This is a multi-agency coalition for which the foundation still serves as a lead agency and provides funding to every year. Thousands of children have received free bicycle helmets, have been properly fitted for car seats, learned about poison prevention, and so much more. Staying true to the Foundation's original mission to support community health, numerous grants have been given over the years to fund outreach programs. Projects like these have been given one-time funding and totals over $100,000 in total support. That's your money invested right back into community health. Within the hospital walls, grants are given to various departments and programs every year, And over the 25-year span, it now totals nearly $750,000. Items have varied from wheelchairs to educational materials, for Hello Babe classes to pediatric occupational therapy equipment, seed money to begin a lactation clinic, and support of EMTs.
Every ambulance in our fleet has a stair chair now that was purchased by the foundation. We have a powered lift stretcher on one of our ambulances so that EMTs don't have to lift patients anymore. I think our first LifePak 12 defibrillator came from the foundation, so the list just goes on and on and on. I think that the equipment that has been purchased over the years by the foundation impacts so many patients every single day that it's hard to put a number on that. A lot of the equipment, a lot of the services, and a lot of the work that we're doing to provide better care for our patients are really the result and directly impacted by what the foundation has done.
It is the compassionate, knowledgeable staff that really makes the difference in a patient's stay and their quality of care. Ensuring that CVPH employees have the best training and most up-to-date skills is important to continually enhancing patient care.
Whatever you can do to further your education, become certified in specialties, all of those educational pieces are going to make you a better nurse or caregiver. It's a great feeling knowing that you have people behind you and wanting you to do better for your patients here at this hospital.
Your support of the foundation has touched countless lives in our region. Fundraising campaigns, large and small, have enabled the foundation to invest millions of dollars into improving the health of our region.
Our daughter was born here. We'd been through the experience of the old unit, and we knew it needed updating. Yes, it was a lot of work. I commend Hannah. She was excellent, and with the help of the Minor Institute, as always, and the community, we pulled it off, and we got a great unit.
The annual campaign, which continues to grow every year, is fueled by a number of volunteers who give their time to solicit their colleagues and friends for support. It is the single largest annual fundraiser for the foundation and has brought in millions of dollars over the years. Special events are another way that the foundation has made friends and raised funds over the years.
I have always loved decorating. I was approached by the foundation to be on the special events committee 17 years ago. How time flies. We have a group of very dedicated workers. We have been from the ferry to the hangar to a beautiful tent at Minor Farm to the cattle barn at Clinton County Fairgrounds. Some a little bit harder than others for decorating.
Other events like bike rides, runs, walks, golf tournaments, dinner at 8, the car show, and book sales have raised money for special projects. These activities have touched many of our donors' lives because they've given them a way to connect with a cause that's meaningful to them. One of the more shining examples of the community's reverence for this medical center is the Circle of Healing and Hope. Located on our grounds, this special area is an extension of the Interfaith Chapel and provides a spiritual and deeply meaningful place for families, visitors, and staff to reflect and rejuvenate. It was created in 2011 and completely supported by community members. The foundation of CVPH Medical Center is so fortunate to have had such tremendous support over this past quarter century. Your support is what has helped people through difficult times, has funded programs that improve health, enhanced the care provided at CVPH, and touched lives throughout the North Country. If this much can be done in 25 years, imagine what the next 25 years will bring.